So on today's podcast, we had Mr. Nick Rhodes and his beautiful wife, Orla, and we were talking all things plastic surgery. Now, if you're anything like me and you sit up late at night looking at plastic surgery and wondering what it's all about and how people have achieved that look, you'll definitely want to listen to this conversation. We discussed all different types of facelifts, brow lifts, blepharoplasty, which is that bit of skin on your eyelids, liposuction, labioplasts, gynecomastia, and everything in between. So enjoy the episode. So thanks so much for coming down.
It's a pleasure.
Nick, you are a consultant plastic surgeon, and Orla, you are the
director of the clinic.
Yeah, the dream team together, I like to call you.
She keeps me in check.
Well, yeah, and you're the one who kind of does a lot of the customer service and the keeping the clients happy and making sure they're okay, the aftercare,
I love
etc.
that bit.
Yeah, Orla does a very useful job. Following patients up, checking
absolutely.
on them post-operatively, and there's no clinic that I've worked in that offers that degree of aftercare. It's fantastic.
No, exactly. Well, that's why
Very
you've
good.
both got such a great reputation.
Thank you.
And you've got a clinic which is up in York.
Yeah.
Yes.
Yeah, it's right in the centre of York.
Right.
It's in an old building, and it used to be the Granada TV building.
I think it was it not Tyne Tees?
Tyne Tees TV.
Right.
Yeah. Yeah, and it's just recently been refurbed, and we've just started doing, for the past year and a half, we've been doing general anaesthetic cases, which
2 years,
has been really
actually.
good. 2 years.
2 years this
Crikey.
week.
And general anaesthetic cases is when you're completely under, so you can do more invasive, bigger surgery. Is that right?
Well, we've got 2 operating theatres, one which is exclusively local anaesthesia, and then when you're doing a general anaesthetic case, there's a lot more requirements for the surgery to meet CQC requirements. So in that surgery, we either do TIVA, which is total intravenous anaesthesia, or we do twilight anaesthesia and sedation.
Okay.
So,
and that's where you're kind of still awake, but you're not really.
you can't remember it.
Yeah, I mean, it's not just where people have a tablet of diazepam or something.
Yeah.
It's actually given by a consultant anaesthetist, and it's using essentially the same medication as the general anaesthetic, but in a much lower dose.
And
you don't.
What are the benefits of doing that then?
I mean, recovery from both is very good. I mean, it's largely personal preference.
Right, okay.
From the patient. I mean, some people don't like the idea of having a general anaesthetic.
Yeah.
They seem to feel that adds another level of seriousness to the procedure.
Okay.
Not that you want to trivialise it at all.
No.
But having sedation, or a bit of twilight, is something that does appeal to people because they don't feel that they're going to sleep. But they won't be able to remember much after the surgery's been done.
But a lot of patients come and say, oh gosh, I'm really dreading it because I'm going to be sick. I'm always sick after an anaesthetic. And that's sort of old school anaesthesia, whereas we do sort of state of the art, totally intravenous anaesthesia, as opposed to when you used to, inhale the anaesthetic gas with that very specific smell.
I have had a boob job. So when I was 21, I had a breast reduction and then I actually lost too much weight, so then I needed implants later on. I had loads of complications, ended up having 5 different surgeries in the end. But I always was really sick after my general anaesthetic until I changed surgeons. And I said, listen, I'm always sick. He said, I'm going to make sure you're not.
It is a game changer.
And the guy who did my last one was perfect coming round. Do you know what I mean? It was really good.
Yeah, we supplement the general anaesthetic or the sedation with local anaesthetic.
Right.
So if you're local anaesthetic and you're waking up really comfortably and you don't need as many, more heavy grade painkillers when you're asleep, and it's those that make you feel really bad when you wake up.
Yeah.
And also delayed discharge from the clinic.
Yeah.
So 95% of the surgery that we do is day case.
Oh, really? So you can be in and out in a day?
Yeah.
Even for quite what you would consider historically big surgeries, like abdominoplasty
we
or something.
never entertain doing abdominoplasty as day case.
Yeah.
When I worked in the private hospitals, the Spire or the Nuffield or Ramsey, they always stayed in for 2 to 3 days. Abdominoplasties with drains. But because we've modified the technique and we use local anaesthetic blocks, patients go home 2.5 hours afterwards.
With no drains.
I know. Yeah, with no drains. It's phenomenal. It really is.
Is that better for you guys and the patient? Well, obviously, it must be
patient.
A lot more cost effective because you're not paying for overnight fees and round-the-clock care.
Well, we do have an inpatient facility as well, and so you just pay more. So it's not that you pay less for the surgery. It's just if you're going to stay in, then that would be added to your final quote. But I think patients love getting home to their own bed for a start.
Yeah.
But also, I think psychologically they recover quite quickly.
Yeah, and we know that, mobile patients after surgery are much better.
Yeah.
You don't want someone sitting in a bed.
No.
I mean, when you think what used to happen, when you went in for surgery, you go in the day before your operation.
Yeah.
You get changed into pajamas. You get your Now magazine out, your Lucasade, and you sit in a chair until the following day. But I mean, now, you come in within an hour and a half, probably you're in theatre, sometimes even less. And then you're going home to your own bed with your own family around you, which is quite nice. And you've got all the control of your own pain medication as well.
Yeah.
If you're in hospital, sometimes you've got to wait for the nurse to come and give you the tablets, and the other nurse who needs to check them is on a break, and it's all very carefully planned out.
Yeah.
I mean, this is how surgery is changing.
Well, this is the thing, and this is why it's become so accessible, because it's almost like it's not this big deal anymore, because it now is... I hardly know anyone who's not real... Well... There's not many women I know who either don't talk about having surgery or they have had extensive surgery. I know people who've had extensive surgery, and I know people who've had just a boob job, or they've had something done. But it seems to be so regular, and there's no shame in talking about it. The rise of it, as we were discussing before the podcast, is probably due to, everyone's more camera facing these days.
Yeah.
Social media, there's cameras everywhere. You're constantly looking yourself in 2 dimensions. Filters don't help. You can make yourself look skinnier and think, well, yeah.
I think people are just taking more care of themselves. And I mean, when you used to turn 60, it was time to don a house coat and get a cake hat. And
absolutely,
that was it. Whereas now, women are rocking it up until, the day they die.
Well, exactly.
So I think you've just got to accept it's just the same as getting your hair done, your nails done. People want to look good, and they don't necessarily want to look good for anybody else. They want to look good for themselves. And I think because I deal with every single patient that comes through the doors of the clinic, I would say that 99% of them are just doing it for themselves.
Well, a woman's beauty is her currency. And when that starts fading, a man will, as he gets better, as he gets older, he gets more power, usually more money, he's accrued more wealth. And a woman is, when she goes from 20 odd, maybe she probably hits peak at 30, and then she's on a downward spiral, and they just don't want that to happen anymore. And you can see why.
No, and it's noticing those early signs of aging.
Yeah.
And people are coming in for surgical opinions a lot earlier than they probably used to.
Yeah.
And that's where you need to advise people correctly.
Okay, so are you seeing a lot more 30-year-olds coming in for facelifts and things like that, or requesting them?
We get
whether you do them or not.
Them, but whether you do them or not is another matter.
And it would be very unusual to do that in that age group. But yes, you do. These things that people see, they see the little bump on the jawline, they see a little bit of hanging tissue in the neck, and laxity, and they want rid of it.
Yeah.
And it's the interplay between the surgical and non-surgical.
Yeah.
And explaining what their options are, at the particular stages of their life. So, in the sort of early 40s, you may be more of a non-surgical candidate, but as you progress through and you've reached the limits of the surgical volume restoration, you'd then be thinking about potentially having some form of surgical procedure if it's indicated.
I do think we've seen a change even in the last 12 months there was a tendency for people just to fill their face full of multiple mils of filler to get a bit of a lift.
Yeah.
But what Nick would say, doing a lot of facelifts is, you come across huge amounts of filler, don't you? And you're thinking, gosh, well, that was put in 5 years ago. And filler that's in places it was never injected, and it's just had a little wander around your face and neck.
Completely agree with you.
Lip aesthetics, again, is changing massively. We're getting a lot of requests for lip lifts.
For lip lifts,
lip lift is an amazing procedure.
Yeah.
It just rebalances the lip, it shortens it, it makes the actual lip margin look bigger because you're changing the proportions of the lip.
Yeah.
And people do say that the lip lengthens as you get older.
Yeah, that's true. I'm dead against, personally, I don't know if you guys do them, but I'm showing my cards anyway. I hate PDO threads.
We don't do them.
Yeah.
We used to.
I think they're just dreadful, ruin people's faces. And the thing is, probably that they don't really work. And, that kind of lift, you'd probably be better with a little stitch. Just if you were going to do that and you actually did want to put a raise in your eyebrow, we might be better with a bit of a lift with a couple of stitches that's going to be permanent. And again, sound like I'm trivialising it, but I'd rather somebody, instead of putting more and more threads in their face, to then the point where they look like they've got whiskers underneath, and it's just...
Well, yeah, you do see some very strange looking people. And you would say, Nick, as well, again, doing your facelifts, people who've had threads in, a couple of years before, then they want the facelift, and you go in and it's just a mess.
And you can probably find like lost ones in
there.
You do. Yeah.
And you find them in very, very strange places. And, the sort of natural plane that you want to dissect your facelift in, depending on what type of facelift you're doing, can be complicated quite a lot. But, threads there. And indeed, fillers can sometimes affect
Agree.
Things. But, you've got to look at the risks associated with it. The actual risk of putting a thread in is not as risky as, say, doing invasive facial surgery. But of course, you've already said that the benefits are much better.
Much better, I would say.
Potentially they will be longer lasting if you're searching a sort of surgical option.
Okay, so let's get into the nitty-gritty of facelifts, because there seems to be a huge, huge chat about it between everybody I know. Men too. There's one man in particular that's coming to mind who I know always asks me about facelifts. I've never had one. I'm not saying I wouldn't have one. I think I would be. You do lots of different types of facelift at your clinic. So shall we go through the ones you do and explain how and why they're different?
Yeah. It's just the evolution of facelifts. I think it's a reasonably common misconception that facelift is just making an incision and tightening the skin.
Yeah.
There are certainly facelifts that do that, and some of these sort of lunchtime facelifts are probably variants of that. This little one-stitch facelift that some people talk about. It's usually just an incision in front of the ear, sometimes behind the ear, and they just take skin away and they just tighten the skin up.
And it tightens the skin,
yeah.
Okay.
And that does very little long term. The problem with using a very short scar when you're using a when you're using a skin-only facelift is that if the skin pulls the structures that it's secured to down, such as the earlobe, or the front of the ear, or indeed the hairline, it can leave you with fairly displaced scars and these terrible pixie earlobes.
Well, I'll tell you who's got them. Joe Biden. Have you seen his?
Nick hates pixie earlobes.
Have you seen his? And I watched a video from a surgeon who said, this is how you don't do that. Like,
he's never had a facelift.
Well, of course, yes. They take a triangle out of the ear at the bottom, and they connect that. Yeah. And then that's how, because you have to leave that bit against your face so that you don't create that pixel.
I think it's all about putting weight. Again, if you want to talk about male facelifts tend to be compromised by male hairline.
Right.
So with a lady, you bring the incision around the front of the hairline, down the front of the ear and around the back, and then down here. That would be a standard facelift incision. But for a man, you may compromise that because he may not want a scar coming across bald scalp.
Yeah.
And he may not have any hair at the back.
Yeah.
So people that just have like a U-shaped scar around here will always be compromising where they can support the skin from.
Right.
So again, there's much more chance of getting pixie ears in that situation.
Yeah.
But Nick, in your skin only, you don't do skin only because you don't really rate them. And but you will always say to patients, it's a bit like being pregnant, isn't it? When you stretch the skin, and it all goes back afterwards, but you always get a little bit of give, don't you?
Oh, you do. Yeah, skin will always relax.
Yeah.
So as soon as you've lifted it, then it's going to start stretching again.
Yeah, so if you can take the force off the skin, which is what the next evolution of facelift is, you've got less force trying to stretch the skin back to where it was before.
And moving the under
you've got
structures.
Things like max facelifts, which were quite popular in the sort of 2000 round then. And these relied on a suspension stitch.
Right.
Coming down and pulling the tissue and basically pulling the tissue up. And then you put another one into the cheek and pulled that back. But again, this was using essentially threads to hold the position of the tissue. The good thing about this was that you were taking skin out.
Right.
And you remove something in the region of 2.5 to 3 centimetres of skin in front of an ear. And that would just pull that up quite nicely. But they didn't have very good longevity. The results would be very good initially, but they would slide away. And certainly when I was doing them and you go back in, you would see the stitch and it was always loose. So you think, well, the stitch is doing nothing.
Yeah.
And it was always thought of, scar tissue actually holding the tissue in position.
Right.
The lifted tissue, but that very rarely is successful. So from that, there was, sort of reignited interest in the sort of smash facelifts.
Right. And what's a SMAS facelift?
The SMAS is the ligament that's inside the face. It's a superficial muscular aponeurotic system. And it's basically a layer on the inside of the face that all the muscles are attached to. And you can take hold of it and you can pull it in this sort of direction. You can pull the cheek back with it. And there were a couple of different variants of facelift with that. You could have a SMAS plication, which is where you put stitches in to try and tighten the SMAS, or you could actually go under the SMAS.
Right.
And as you went under the SMAS, you could release some of the ligaments and pull everything back and secure the SMAS back.
So you would essentially you'd cut those ligaments and then pull them back and re-stitch them into a new place.
I kind of describe it, I don't know whether this is right, but when I'm describing it to patients about the SMAS, all the muscles of your face are sort of connected.
Yeah.
Almost like if you've got a load of steaks and put them in a vacuum seal, but they've got their separate pockets.
Right.
But the whole pack moves together.
Right. I quite like that.
Yeah.
Do you like that?
I like that.
Thanks very much. Yeah. And then you sort of pick up that vacuum pack on the top. That would be a superficial SMAS facelift. So you're talking about VRs and...
That's a TikTok video right there for you, to be honest.
And then if you
get a bag of steaks,
you're going to have to buy some steaks.
Ladies, this is what a SMAS facelift is and this is what we do.
Yeah.
I think that's fair enough. But I mean, if you go under the SMAS and you are taking some of the weight of the face on that SMAS, you can pull things in quite nice vectors.
You get less relapse then.
And you get, better longevity. But there's a little bit more risk associated with it because you're operating right on top of a nerve that moves the face, and there is a chance that can be bruised and injured with that. But if you start to do what's now called a deep plane facelift, you're coming into the SMAS a little bit further forwards and you're releasing a lot further into the face. So you're pulling things on a much nicer vector and you're releasing ligaments around the jaw and around the face that can allow you to reposition the mid-face as well with this.
Right.
And because you're releasing things maximally, you're taking more weight off the face.
Yeah.
So there's much less weight on the skin. So there's much less chance of it relapsing.
When you do surgery, do you do it? So you do it lying down?
Mm-hmm.
Yeah.
I always think, do you ever put the patient up to see if they're even and stuff
all
like
the time.
that?
I mean, most of the time.
Keep checking and keep checking and keep checking to say, right, okay, it's looking balanced. This is one of my big fears. Like, if I was
That's why you got to buy a special, very expensive operating table.
Absolutely, yeah.
Most of surgery is at 45 degrees.
Yeah.
You know, we don't often have people
lying
completely
down.
flat. And breast surgery, you know, when we're doing that sort of stuff, you know, you want to see the breast sitting up.
It's sitting,
You know, so you'll sit the patient up into it. And, their arms are supported on things. And, you know, you have a look.
Yeah.
Because, I mean, that's what you want.
Absolutely, especially if they're like you're balancing, say there was an unevenness in the face.
Yeah, if the implants need to be the same level, the nipples need to be the same level. And in the face, you know, you do want to be tightening things nicely on both sides.
Yeah.
But we do a lot more now at the front of the neck.
Okay.
You know, so again, with our facelift now, we're coming in from the back, quite extensive.
I mean, for the neck, I always think, well, where do you put neck skin? Like, say I've got like a big turkey neck like that.
I mean,
like, where would you go? Like,
I mean, it all comes upwards and backwards.
And always to the ear.
Yeah.
Right.
I mean, that gives the nicest vector.
Yeah.
I mean, some people want this really sort of horizontally stretched look, which is really bizarre. But
the difference...
it's adequately redraping all that skin and pushing the skin over towards in front of the ear and then removing the excess.
Yeah.
But the neck, we make a little cut underneath here.
Okay.
And through that, we can come and do the bands.
Right.
So these platysmal bands, these little, you know, well, you haven't got any, but I do. So these bands down here.
You haven't.
And they look massive. And then when you get in there, they're pathetic, aren't they?
Yeah, they're tiny.
Right. You can put those together.
You can stitch those together. And then when you do your pull from the back, because you fixed it in the middle, you get more of a lift.
Right,
so you get a much better definition of the jawline.
Okay.
Before we did this, the muscle would just move backwards and you didn't really get the same improvement.
Right.
But it's all about wanting to leave someone looking nice and natural. And, you know, the biggest compliment for me is when someone comes in and says, you know, no one's noticed.
Yeah.
No one said to me, you've had a facelift.
Right.
You know? And the first time someone said that to me, she says, "Oh, no one said you've had a facelift." I thought, where's this going?
Yeah, do you find any women are disappointed by that? Because I know a lot of people like to hyperinflate their lips so that people know that they've had their lips done. They like to have the whitest, most fake-looking teeth because they want people to know they've had them done. And I know people who go to extremes and have themselves stretched and because they want people to...
Yeah, it tends to be younger people, and that would be this extreme lift, which we don't really get into.
No.
I think restoring someone's natural beauty is where you want to be.
That is definitely our kind of ethos.
That's exactly.
You don't want to be significantly changing people's features.
No.
And, a lot of this work is, it can be reversible.
Yeah.
And you've got to get it right.
Irreversible or reversible?
Irreversible.
Irreversible, yeah. I was going to say.
If you're shortening a lip and you make it too small, there's nothing you can do.
No.
It's got to be right.
Exactly.
And it's got to be right on the face. I mean, that's why it takes such a long time for me to do facelifts, because you've got to leave that patient thinking that you've done the best job that you possibly can.
You'd rather do I'd rather do less.
Less
get
is
used
more.
to that, and then
Although a lot of patients, I mean, much older patients would come in, they'll have their face and neck lift with their upper and lower eyelids and a lip lift at the same time, and then have one downtime.
Yeah.
Which I can understand.
Yeah.
And that's nice because the overall impact of everything. And I mean, it used to be I'm having a face and neck lift. Now it would be having a face and neck lift. I'm having a temporal brow lift. I'm having my lower eyelids done. I'm having a pinch blepharoplasty done. I'm having a lip shortening. I'm having a little bit of fat transferred into my cheek, and I'm having buccal fat removal. All these sorts of little things.
Mm-hmm. Things have changed a lot.
They're all harmonious with each other, it gives a much nicer result.
Well, I was just about to say, I think if I was ever to go down that route, I mean, you're now seeing the rise of £250,000 facelifts. These are the ones I was looking at the other day in preparation for this chat, and I was like, my God, 250.
So that's why they're coming over from New York to see Nick.
Yeah, and I was just like, my God, oh my God. And I actually did a live with a surgeon. It was in lockdown, actually. I mean, he starts at 50 grand, and he was in New York as well. But crazy expensive facelifts. And I'm thinking, well, what are they doing that's totally different?
Exactly.
Probably nothing.
It's
just
hype.
Yeah, absolutely hype. But I would suggest that probably doing everything at the same time is better. Because if you're like building a house, I wouldn't want to be doing this, I wouldn't want to be doing the garage and then not the rest of the house at the same time, because structurally things might change. And also you don't want to be pulling one muscle down here and then that throws something off up there.
This is, again, one of the differences between types of facelift. I always say that doing a facelift is a little bit like making your bed in the morning.
Yeah.
If you've got your duvet all crumpled up and you take hold of it with one hand and you pull it, you'll get one tight band of duvet, but there's baggy bits on either side.
Yeah.
If you do what most people do to take the duvet with broad hands and pull it, you get a nice smooth finish. And that looks more natural, if you're doing it all. And the small incision facelifts can sometimes only correct one area.
Yeah.
And if you were to sit most people in their 50s down in front of a mirror and say, what would you like? They wouldn't do that.
No.
They'd sort of do that.
Yes.
They push more from the neck.
Absolutely.
And this gives a much nicer, more natural appearing result.
But that's something you always talk about is vectors, isn't it? Because
it's very important. To pull in the right plane.
The smaller facelifts, or the VR facelift, which is one we do for younger people who they have a bit of a jowl, but they don't have any neck issues. That's a vertical redrape.
A VR, would I be a good candidate for a VR? For me, I'll tell you, I don't mind saying it, I am very unsymmetrical. So I always get shot on this podcast from this side because I've got a better jawline on this side, and I always make my guests sit on this side.
I wish I'd sat over there.
I think 90% of people are asymmetrical. It's phenomenal.
But mine is very noticeable.
It tends to be the left side that's a little bit shorter.
I think I've got my jaw is longer on this side.
Oh, right, yeah.
Personally.
Okay. Yeah.
So, but I always sit in the mirror and do this. Right? And I think, well, if I just got a lift on one side, not the other, you might go, you can't do that. Then it would even me out on both sides. Where's the camera, Jacob? Because I'll just, that one. Okay, there we go, guys. So you can do this with me. So I am quite unsymmetrical. I'm like that, I think. Anyway, I just think if I did that, I would have a better jawline on both sides.
That looks more asymmetrical to me now.
Oh, do you think?
Yeah.
You've got to be very careful chasing skeletal asymmetry because it's
skeletal being bone.
Yeah, the bone. because it's not the skin that's
No,
wrong.
well, this
It's
is the thing.
probably
It's the jaw.
It's my
actual
jaw.
bone.
And then, so I looked into, this is what I do sometimes late at night. I look into these things. You know, when you're like sat up thinking and everything seems like the world seems worse in the middle of the night. So I'm sat there and I'm looking at jaw surgery. And I actually had a conversation with a jaw specialist. And he said, did a case like yours this morning, actually. I was like, all right, okay. He said, yeah, quite brutal. He said, I have to go in through the mouth, blah, 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 down, break the jaw, shave the jaw off, shake that bone off. You know, he said, and that's how we make it symmetrical if you want to go down that route. And I was thinking, it's a bit...
Well, Nick used to do this when he was Max Vac surgeon, so you would definitely say no.
It's an awful lot of surgery
It
for a tiny
to achieve.
improvement. And a lot of risk.
Yeah, that's exactly what I came to the conclusion.
All that sort of stuff.
Yeah, so I just thought...
it's like, that follows into facelift, you know.
Yeah.
You've got to think about the risk benefits of all these procedures. And that's one of the problems when people in their 40s come for a consultation for facelift, you know. You've got to say, is the improvement that this patient's going to get worth the surgical risks?
Yeah.
And also worth the expense of what she's going to invest in it.
Right.
You know, and I say that surgery is not to treat laxity of the skin, it's to treat a bump on the jawline, you know, the jowl.
Yeah.
And if you can't see that and it's just this that you don't like, you know, that's not an indication for facelift.
Yeah.
But
certainly
also,
not in my practice.
you always say to patients as well, Nick, don't forget you will always get a bit of relapse.
Yeah.
So I've been nagging him for some time to do a facelift. And he said, I haven't got enough skin.
No.
So because you need to be able to get quite a, you always say the fingers.
You look like you're very tight already. You're like very.
Do you think?
Tight.
You see, I don't see that. But Nick will always say the finger's better than the knife. So you can go like this with your fingers. Yeah. But unless you're going to get a good 2.5 or more,
you can get
centimeters on each side. You know,
amazing amounts of skin out. But you know, skin. If you're taking too much and putting too much tension on the skin, you're going to move the hairline, as we said, and move the earlobe. No good.
No.
You know, so you've got to justify all that work to give you the improvement. And if you can manage those patients, you know, non-surgically for a short while, then that's good.
Yeah.
Until they're more a surgical candidate.
until they're ready.
You know, and if they have very little improvement, very little jowl, and they're getting a tiny improvement in it, you know, when it's relapsed a little bit, you're not going to perceive that you've got any improvement. And that's when you'll be disappointed.
Yeah.
But I mean, people want surgery because people are talking about surgery.
Absolutely. And they're just like, they can't bear looking at themselves. And
No.
I do get it. And I know quite a lot of women like that. I'm actually too busy sometimes to like sit there and pull my face apart. Honestly, I wish I had the time to do these things, but I can understand it. The only other thing that I think a lot of the time, a lot of my friends discuss, people my age, I'm 37, are temporal brow lifts, because obviously they try and get that look with Botox, but it's just not that really achievable, doesn't really last that long. And now this fox eye trend is which again you can create with threads but looks ridiculous, and then you get a big like hole in your eyebrow. But again, I don't know, a nice lift on the eyebrows is quite
I
youthful.
think fox eye, I don't particularly like it,
no,
but
I wouldn't like that.
That's personal choice. But also it is a trend, a bit like buccal fat pad
Absolutely.
removal. So I think you've got to. And what's the new? The snatch jaws, the one that we're talking about this week, isn't it?
Snatch jaw will be taking salivary glands out as well.
You know.
Oh, what? So you haven't got any spit glands?
Well, you've got the big ones, but you know, you take that out just to get the ultimate definition.
I don't really believe in the buccal fat, because I think as you get older, you're going to lose that volume anyway,
and then you're going to start looking really weird.
A heroin addict when you get like really old. I would not touch that.
I think it works very well in Asian people.
Yeah, it depends.
You know, they've normally got quite rounded faces.
Exactly, I'm with you on that.
But so the trend for fox eye, but lateral brow lift or temporal brow lift.
Yeah, temporal brow lift.
Definitely.
So where would you go in on that? Is it around the hairline?
You make an incision just in the hairline. Again, it depends where your hairline is.
Would you go vertically? Because I see that one a lot.
The vertical one would be the endoscopic brow lift.
Right.
Where you make 2, 3, 4, 5 incisions.
The ponytail lift, they call that.
Yeah, I mean, it's where you pass little instruments down and you free everything off, and then you stitch everything in a lifted position.
Okay.
But it's got quite a high chance of relapse.
Really?
As a lot of them have.
Right.
Because you haven't really got anything strong to stitch it onto.
I mean, I think that
the success with a brow lift is to do a good enough release, and you have to release right the way around the eye socket.
Oh,
There's a tendon
really?
here
So it's
that-
not just pulling skin back there.
No.
Okay.
Be
So
easy if it
And
was,
we
wouldn't
talked about the hair, the skin in front of the ear not tolerating tension. But if you put tension onto scalp, the hair follicles die.
yeah, and you
So
might
it can
get
take it gets alopecia, so it might take a little bit of time just for it to come back. But a little temporal brow lift is a little incision up there. You pass an instrument down, you free everything off around the eye socket, you free everything off here, and then you can stitch this up onto some strong tissue on the inside.
So you prefer that to an endoscopic brow, don't you?
Yeah, endoscopic brow, you haven't got the same, well, you can dissect in this area and free all this off, but, it's got quite a high relapse rate, and I've tried doing all sorts to try and reduce that because you're taking this central heavy area and you're trying to suspend that. And there's a lot of weight, in the brow. And there's a lot of muscle action.
Yeah,
on
a
it
lot
as
of
well.
muscle action.
You know what I mean? These muscles here, trying to pull the brow down, that's just trying to undo your result all the time unless you paralyze it with Botox.
So where do you attach it then for, is it temporal fascia?
Yeah, you attach it onto the deep temporal fascia. So,
So the temporal fascia is, in layman's terms, so you've got your big temporal muscle here, which you can clench. It's sort of the layer that covers that is quite a thick layer.
Okay.
So, isn't it?
Yeah, there's two of them, the superficial
And
but
deep temporal fascia.
The terminology is a bit different.
Okay.
But it's quite a nice, and I mean, the thing that the fox eye does is that you can detach the ligament that supports the eye here.
Right.
So if you free that off and stitch it in a higher position, you can change the sort of slant of the eye.
That's Bella Hadid, I think, isn't it?
I just don't like that. I just don't like that. And I tell you what, I've seen more bad ones than good ones of a fox eye where people can't even shut their eyes now.
Yeah.
And I just think
it can look very strange.
Yeah, it can.
It can.
I agree.
Yeah.
So while I would like, again, a little bit of a lift, I don't think, and maybe, I don't know, and then you could maybe couple that with a bleth. For anybody who doesn't know what that is, that's a bletharoplasty, is that?
Yeah.
And then is that taking away some of that
You can take away a little
skin?
bit of skin and just lift the temporal brow up a little bit. You can.
And you'd look a lot fresher.
You'd kind of go down that route first, I think,
Yeah.
before you'd embark on a temporal
brow lift,
brow lift.
Yeah, because...
Oh, would you? So you do the bleth first?
Yeah.
Yeah. And that can really open up your eye a bit.
Yeah, I mean, there's so many different types of brow lift.
Yeah.
And I always tell patients if there's a lot of different treatments for one condition, none of them are ideal.
Okay.
The
the Alan cracks it
they
just
either leave terrible scars, they're not effective, or they only work in certain people's hands.
Yeah.
And there's probably about 20 or 30 different techniques.
Oh, wow, really?
And every year,
something else is coming out.
A brand new technique. And at the moment, it's a sliding brow lift.
Sliding brow lift, right? What's that?
Sort of, it's where you undermine everything and put a hemostatic mesh over the skin to keep everything in a lifted position.
Right.
And you keep the stitches in for about 5 to 10 days, and you take the stitches out, and it's supposed to hold the skin up a little bit. And that's the latest. It's dependent on obviously who's doing it. And,
the techniques, the surgeon,
and the candidate.
Yeah.
The patient who's having it done. But I mean, things in medicine that have only got one treatment, such as gallstones.
Well, exactly. They've
you have a
you know.
laparoscopic cholecystectomy. There's not 20, 30 different options.
Yeah.
And it does. It sort of speaks volumes. That.
Right. Okay. Yeah. I see that a lot. A lot of chatter in my age group around having their eyes done or that kind of like lift.
Yeah. We do thousands of eyelids,
procedure.
And you can do that awake, can't you?
Yeah. Yeah, it takes an hour and 15 minutes.
Do you?
Yeah, we do. Yeah, we do.
A lot, like literally blinking as you've got like a scalpel in the eye.
But you don't blink because your eyes are closed for the whole time.
Yeah, you've got the eyes closed, and it's okay.
Really?
I had it done myself.
Right. Okay.
Yeah, surgeon has plastic surgery. That's
right.
terrible,
Okay.
Yeah.
Who do you get to do your surgery?
This is one of the surgeons in the clinic.
Right.
Mr. Smith.
Right. Okay. Great.
And I mean, it wasn't bad. I mean, I'd run away at, having a flu jab. I don't like injections or needles, but it was absolutely fine.
Really?
Yeah.
Right.
Yeah.
It's very well tolerated. But you prefer doing it awake because it needs to be a little bit interactive.
Okay.
So when the patient's asleep, you just have to make sure that your markings that you did before they went to sleep are absolutely spot on. Whereas when the patient's awake, you can actually say, right, we've taken away the skin, muscle, whatever, fat. Let's have a little look. And you will stop, wouldn't you, and sort of say,
you can just fine tune it, because the brow is when you're asleep, and as you quite rightly said, you're not sitting upright. You're slightly far back, or you may even be a little bit lower for that. The weight of the brow is not the same. So if you're sitting up and you're being marked when you're awake, it's great.
Yeah.
Because you can get it absolutely spot on.
Yeah.
And it is tiny margins, isn't it, for this?
Yes, it is millimetres.
Fractions of millimetres.
Well, that's the thing. We're talking millimetres here for this. Yeah. I mean, do I have enough skin for that? This isn't like a personal consultation, by the way.
No, I know what you asked us here.
I just know if somebody's like watching this and they're going, oh, maybe I'm a candidate for that. Like, who would be a candidate for that? So I'm thinking, am I a candidate for that?
I mean, you get more skin in your upper eyelid, for a couple of different reasons. The first thing is that you get crepiness of the skin. So a young person would have a smoother fold.
Yeah.
And you don't tend to see a knife edge.
Yeah.
And it's when you start to get that knife edge that you could probably think about having something done.
Yeah.
And also the brow comes down. Again, some people will control the brow position with Botox just to give you a little bit of lift, and that will keep it at bay.
Yeah.
But, if you are not getting the lift with Botox, or you're so concerned that you've got this extra fold of skin, then it's time to think about having it done.
Yeah.
And I mean, it's incredible what improvement some people will get from
I don't think
surgery.
It's not something I wake up and go, I can't deal with my eyelids.
No.
But not like it does my jaw. But but yeah, I'm just thinking, who would be a good candidate for that? And I suppose it's people who are a bit more hooded.
Yeah.
Well, there's genetic sort of predisposition to it as well. And, so some girls who are relatively young, so maybe they're late 20s, early 30s, and they come and you think, really? And then you see them, you think, actually, yes, but it's more of sort of a genetic.
And sometimes you can have abnormal fatty deposits as well.
Yeah.
And if you take the fatty deposits out,
and that
it
makes
takes
a
some
big
of that
difference.
puffiness away.
Yeah.
And they can do quite well.
And then we have
they
80-year-olds who have it done.
Oh, absolutely.
Because they can't read.
Yeah.
And there's the
because it's sort of a functional side of things. So it's, and I personally love the fact we get more and more men coming for surgery for everything, for their eyes, lower eyelids, repositioning fat. We don't do that under local anaesthetic though. That is sedation or general anaesthesia. Because
there's a couple of things that I wanted to touch on. So I was looking on your Instagram page before we were sitting down to this podcast, and you'd just done a male patient who had gynecomastia.
Yeah.
So are you getting more? I think this might be a personal opinion, but I think there's a huge rise in males with breasts now, and this is not
moobs,
just
as they call them.
man boobs, bitch tits, gynecomastia, whatever you want to call it.
I've heard of that one.
But I think there is a massive rise of it. Now, I've got my own theories on it. One, I think there's too much estrogen in the water.
Yeah.
2, the rise of plastics. 3, environmental factors.
Yeah.
4, obesity, terrible diets, processed food, everything. Because we're not just talking about weight, where they put weight on and then they put a bit of weight in the boobs. We're talking about actual breast tissue growth in a lot of these cases, aren't we? And I think we're just seeing more and more of it. So I was glad when I saw that. I thought I'll bring this up today.
And of course, the other reason is steroids at the gym.
Well, that's the other. Steroids,
and,
because
and diet supplements.
Absolutely. So they're taking testosterone, which aromatase turns into estrogen. We talk a lot about hormones on here. So, that can cause breast tissue, breast growth.
And it used to be something that was looked on sympathetically by the NHS.
Yeah.
And in my NHS practice, I used to see a lot of people with gynecomastia.
Yeah.
But it was always incredibly difficult to get them approved.
Right.
On the NHS, if you have this problem, you've got to present to your doctor, you have your blood test to make sure there's no hormone imbalance, because sometimes other things can cause gynecomastia, medical issues. And once you've cleared those, it will come back to your clinic, and then you write to a panel to say, would you support this patient's surgery? And at the start of my career, not a problem, but towards the end, no.
It's the same with everything. It's like breast reductions and everything.
And it's not always bilateral, but I had a chap who was a scaffolder.
Right.
And he was a really young, fit, healthy looking bloke. And he had one breast.
Right.
And this was maybe a B cup.
Yeah.
And he had tattoos all over his chest, and he was a really good-looking bloke. You just think, there's no way that he would have gone on holiday with that situation.
Yeah.
And, we treated him. And I mean, it made such a massive difference to him.
I know a guy like that, covered in tattoos as well. Maybe it's the same guy. And he told me, he said after had one done.
But I think that I put that post out on Nick's Instagram, mainly because I think there's a lot of young guys out there that are not educated about gynecomastia.
Yeah.
And it was really just to maybe pique the interest in it as a medical condition.
Yeah.
Because I'm sure, patients of ours that have it done, they'll say, every single time I go on holiday, when I get up off my sun lounger to go across the bar to get a drink, I put my T-shirt on.
Really?
It's terrible.
And you just think,
I think it's getting worse and worse.
That's really sad, isn't it? That people just don't know about it.
Yeah, as people get more aware of it, you, if you had it, would be even more conscious of it.
Yeah.
Because people would say, oh, he's got that
He's
condition.
got gyno. Mm-hmm. Yeah.
He really ought to get that sorted or, whatever. But, it's something that can be treated. Now we've got Vaser. We can do it with much less need for scars.
So I was going to say, what's the incisions like? Because a lot of people, especially men, would be put off by that. Is it this, would it be like a traditional breast reduction where you would go underneath?
In severe cases, it can be.
Right.
But in sort of moderate gynecomastia, you can normally treat that with liposuction.
With liposuction.
And that one was just
Vaser
liposuction.
liposuction. There is a difference.
So what's the difference between traditional liposuction and Vaser liposuction?
Yeah, traditional liposuction would be what's called suction-assisted liposuction, which requires you to pass a cannula through the tissue, through the fat or the breast, and with suction and physical force, remove tissue.
Right.
Whereas with Vaser, you actually use a Vaser probe, which has an ultrasound energy pass through it. And essentially, the energy is focused at the end of the probe. And when you put it into the tissue, you're using the ultrasound energy to break down the fat cells and break down some of the glandular tissue.
Right.
So you can be a lot more precise with it.
Yeah.
And because you're not using physical force to break the tissue down, you're retaining more of the ligaments which support the tissue. You're not removing as many blood vessels, and it's much less traumatic.
Right.
So it's much more gentle on the actual body.
Yeah.
And I think the thing that I like about it is that you can be so accurate with it.
If
you feel that there's a pocket of fat somewhere, you can put your probe in and you can release it.
Yeah.
With your Vaser.
Yeah.
And you can feel the Vaser working. And it's just, it's finger and thumb, through the tissues. And it's not big shoulder thing.
No, I know. I agree. I've seen a lot of ladies who've had this. I would say 90% of the women I chat to absolutely hate their arms. I'm probably one of them. So especially as you get older, top of the arm always seems to be a big issue for a lot of women. And now I'm seeing like a few ladies having Vaser there. Would that be a good candidate for that?
It is. You're always weighing up skin laxity.
That's the other thing. So I know a lady who is probably 65 and she's like, she thinks she's got too much skin there.
Yeah. And if
Nick's
you've had
always
a lot of
really
sun
honest.
exposure as well, if you've had a lot of sun exposure, again, the sun will cause crepiness of the skin and it's not going to bounce back like young skin that hasn't had...
my skin, Nick.
Not your skin, darling, yeah.
No, because I've had Vaser of my arms.
Right.
Yeah.
But now, this laxity, there's nothing... It's going to need a brachioplasty.
It's a lot better than it was, isn't it? But
I loved it, but
and with Vaser, you can work in a much more superficial plane, which will deliver energy to the back of the skin and cause some natural tightening of the skin itself. And because you're retaining ligaments, the structural support of the skin, it's better that way. But you can also use Renuvion.
Yeah. So this is Renuvion or J-plasma. Yeah.
Which is basically delivering energy to the undersurface of the skin. So traditionally with radio frequency, you'd be delivering it from outside, which meant all the energy had to pass through the skin before it got to the bit that you wanted to treat.
Tighten,
So it always limited the amount of energy that you could deliver because if you delivered too much, you burn the skin.
Right.
So if you've got a little probe that can go inside the skin through the incision that you use for your liposuction, your Vaser, you can actually deliver it right in where you need it. So you can use much higher energies.
Okay, so in layman's terms, ladies, if you did want to kind of have your arms tightened, you could then have some fat removed with Vaser liposuction and then have it tightened with the Renuvion, and you should get a nice tight result.
Yeah,
depending on where you start.
Depending on the skin laxity.
Your starting
if you've
point.
got like maybe not too much. If you've got a lot of fat And a lot of skin. I mean, you'd go back to the traditional, is it brachioplasty, where you'd have a scar there?
Yeah, which,
what we do now...
It leaves a scar, but, I've never met anyone that has said, I prefer my loose skin to my scar.
Yeah.
Never.
What we do now a lot of in the last 6 months, which we never used to do before, is when patients ring up the clinic and say, I think I need my eyes doing, or would I be suitable for a lip lift? To see Nick's 6-month waiting list. So I'll say, just to sort of separate the wheat from the chaff and not waste their time, I'll say, send me photos. And I do the same for arms, I do the same for breasts, faces, necks. And it's brilliant because it gives you a really good insight. And you can say to people straight away,
you're just not...
you're
not going to get the result. Yeah. Or
barn door
we know
obvious.
you want that, but realistically, we're going to suggest this for
it
you.
just sort of...
It's like the old mini consultation that we used to do.
Yeah.
I mean, I don't make all those decisions myself. I do show them. It's just,
of course.
But sometimes it's really obvious.
Yeah.
But it's just a quick way of, am I suitable or am I not, before you spend money on a consultation.
Exactly. Yeah, for sure.
The
Vaser just allows you to be able to sculpt the tissue as well.
Yes.
So, if you have an arm which is, globally a little bit full and you want to add the deltoid on, you can add that
muscle there.
You can add a groove down the side as well, You can put
Does it look
down.
A bit fake though, adding these grooves?
It depends how you do it. And again, this leads us on to
the
talking
skill
about
of the surgeon.
high definition liposuction on men and women.
Right.
And there's moderate definition and there's high definition. And if you are someone that just wants to have a six-pack and you're not prepared to go to the gym and you just want someone to do liposuction, it's not going to be good.
No.
The result will be fine.
Yeah.
But as you revert to type, you will put weight on.
Yeah.
And that ripped abdomen that you had would be awful.
Yeah.
And again, the skin as you get older will become a little bit more loose and a bit lax, particularly if you've fluctuated in weight.
Yeah.
So the good candidate for something that's more higher definition is someone who's nearly there, but they've just got a little bit of fat.
Me, basically.
Obscuring this
I
six-pack
sit there
underneath.
with my PT and I'm like looking at my arms, and everybody who follows me on Instagram will know how much I work on my arms and my guns, and I love it. I love training. I love weight training. I eat right. I don't drink. I do everything correct. And I'm like, just want to lose this little bit. It's the only place I really carry weight. I'm so lean here. It's probably my back and the back of my arm. So I have to get so low in weight to even kind of, and now I've got, you can see great shoulders, you can see great delts, you can see tricep. I've got a nice bicep. I know that. But I look at Khloe, I look at Khloe Kardashian and I'm like, she has definitely had her arms vasored, because there's no way she can have all that proportional fat in her ass and everywhere else without.
But is that Khloe Kardashian? Because she doesn't look the same as the human being she was 10 years ago.
No, exactly. But honestly, I just think, I'd look amazing if I had my arms done. But then I also get scared. So.
I think that's one of the things. How far are you prepared to push it with diet? And is it achievable? And have a
sustainable.
reasonable, and sustainable. And certainly, men that have this liposuction, the high definition stuff, it can look very, very strange.
Yeah.
And I'm sure you've seen that picture of that very large bloke leaning on the reinforcing mat from the concrete. Have you seen that?
No, I don't think I have.
The metal sheets that they put in concrete floors.
Yeah.
They got. It's one of those men just leaning up
against
it.
It's got an instant tape.
A chain link fence.
Right, and that's what it could look like if you did high definition and then carried on boozing.
Precisely.
Yeah. Okay.
Yeah, he would.
Yeah,
so it's not ideal. But I mean, liposuction now on ladies, before it used to be just a sort of global removal.
Yeah.
At the front. Yeah, we'll take the fat down. And the techniques are never good. It was seemed as something that was fairly quick to do. But I mean, a Vaser case now, it's 3.5, 4 hours, if I'm doing the back and the front. And when you're doing that, you can put the nice groove down the center.
Yeah.
And have that nice little dip.
Yeah.
You can put a nice groove going
little
down to the
crack.
groins.
Yeah.
And it's something, again, in the little sort of triangles that you can get at the side. You can put all those on.
Have you got those, Alyssa?
I have, but I've worked hard for them. And I sacrifice a lot, I sacrifice. No, I don't eat what I want every day. No, I don't get to do anything that I want. No, I don't go partying. Everybody knows I live like a monk. You know what I mean? And
as long as you're happy.
Yeah. No, I am happy. Like, if I'm not working if I'm not like bullying myself internally, then it's not a great day, you know.
I wish I was like you.
No, I'm like
on the other extreme.
But it just allows you to be able to just add that little bit of interest.
You pretty much don't use anything other than vaser now for your liposuction, do you?
No, it's like something's happened.
I know.
Well, why go backwards? Because it seems to be you can be more accurate, you can be more gentle, but it's better for you, it's better for the patient, the result is better.
Yeah.
You know, you've got to limit the amount of liposuction you do, because there are impacts on the overall health of the body when you do it. But because you're removing fat in a less traumatic way, you can do little higher volumes.
Yeah.
You know, with vaser.
Yeah.
You know, and again,
but I mean, you've had years and years and years of liposuction experience before you came to vaser, didn't you?
Yeah.
And I think there is a little bit of a misconception as well that liposuction is easy.
Yeah.
Oh.
And you would say it's one of the most difficult things that you have to do
like
as a surgeon.
Having a block of marble, putting a duvet over it, and trying to carve the Venus de Milo.
Yeah. Oh, I can imagine.
Without being able to see it.
Yeah, I can totally imagine.
I like that.
I like that.
And it takes a certain level of skill. And that's the thing. How long have you been a plastic
20
surgeon?
years,
20 years, yeah. You've got to go to somebody who you trust and you want to see their work.
Well, word of mouth, I think, is the best thing, the safest thing.
Yeah.
But no,
for everything.
It's a really difficult technique. You know, and as I say, if you see a video of someone doing it, you think, God, that looks easy. It's not.
No.
It's horrific.
Oh, God.
You know.
The other thing I've seen a rise of is labioplasty. Again, I don't know if this is because it's more readily available or through the internet, people talking about it more, or it's become...
I think probably that reason.
Because I can't imagine 50 years ago people were bothered about what that looked like down there. And now it seems to be, well, I can go and get something done about it.
This is a different generation for me, but, you know, sending photos of yourself to somebody you met
I mean,
at a nightclub. I don't know what they do, but
it's a different generation for me because I just wouldn't do it either.
Exactly, but I think, so there's a lot of young girls coming for that. But again, Nick will only do procedures that he thinks warrant surgery.
Yeah.
And then postpartum labia as well, I suppose that's another
people
group of women.
Tears, you know, or whatever. But I mean, it's just like anything, as you get older, you do lose some of the structure, you know, and you get some emptiness there.
So I had a lady on the podcast last week, right? So, and she was talking about you can put filler in there.
You can, yeah. Okay. On the outer labia.
Right.
You can put fat transfer in there just to fill that up because, again, as you get older, it can look a little bit empty. Right. Yeah. The actual inner labia can become a little bit longer. Right. You know, and they can hang down. Yeah. They can interfere with sexual function. They can interfere with comfort in clothes. Yeah. Interfere with confidence. Yeah. You know, all those things. And we do tend to restrict it to people who have functional issues with the labia. You know, we all carry insurance for procedures that we perform. And some of the people who offer the indemnity do stipulate that they will only insure people against labioplasty if it is a functional procedure. Okay. So, you know, just doing it for pure cosmetics, again, is something that you've got to think very carefully about. Yeah. Whenever I counsel someone about labioplasty, you always say, you know, you might get a painful scar. Yeah. You know, and if you had a painful scar down there, it would be an absolute disaster.
Exactly, because we talk a lot to a lot of ladies who have painful sex because of the menopause or, you know, hormonal issues that they might be having, vaginal dryness, things like that. So you can't imagine compounding that with a painful scar as well, and then being completely in discomfort, never having sex again.
And it's everyone's perception of normal.
Yeah.
You know, and some people will appear to be perfectly normal. Yeah. And they will perceive that they've got terrible hanging tissue. Yeah. You know,
well, this is the thing. What are they watching? Maybe it's the rise in pornography where, you know, again, women really don't look like that in the real world. That isn't how you have sex with someone. I guarantee she's not having a good time. I'm like, I always say to my male friends, I'm like, if you think that that's what a woman wants, you know, if you're watching those porn videos and think that's what a woman wants, we don't. We definitely don't want that.
Well, that's the conversation I had with two of our sons when they were growing up. I mean, they're 20s now, but, you know, saying to them, because they have access to that kind of thing. I said, don't ever think that that's what your girlfriend wants.
I know.
You know, yeah.
Yeah, I mean, we know a sort of sex therapist as, you know, sort of professionally, and I mean, she would say that there's a huge rise in erectile dysfunction.
Right.
In young men. Males.
Right, yeah.
Because they want to have vanilla sex.
Yeah.
You know?
Yeah.
It's like they don't really want to be strangling someone.
No,
partner.
well, this is the thing.
And that's what
how do we get onto this?
I know.
It was you started talking about it.
Yeah.
But no, I mean, I think, you know, the surgery, when it's carefully planned and it's for a good reason, you know, it could be quite good.
I read a report that the labioplasty, the rise of it is because everyone's now wearing athleisure. So everyone wears leggings and gym pants everywhere, don't they? And, you know, the spin class is making women go and get labioplasties. I was like, right, okay, that's a bit of a stretch to the imagination from the independent there. But I can.
I think it's probably more to do with sort of the social norm now for the younger generation.
I mean, I've never spent a lot of time staring at it down there, to be honest. But who knows, in years to come, if things change, I might do that too. Who knows? But
well, at the clinic now, which I'm very proud of, we have 3 consultant plastic surgeons who are female.
Right.
They're all mums.
Yeah.
And they've all got an interest in labioplasty, which I think for some women, it's such an intimate part of your body. Going to see a male surgeon, however wonderful they are, can make them feel a little bit uncomfortable. Yeah. So it's lovely to be able to have that.
Absolutely. Yeah.
So,
yeah. Oh, great. Well, the one thing I did want to bring up was you are like, you're up north, aren't you, in York? Yes. A lot of these surgeries that you hear from, a lot of people have to go to London or whatever. But it's great that you're up in the north.
I know.
You're in York.
Doing a bit for the north of England.
So if people wanted to get in touch with you, what's the name of your clinic?
It's the Coppergate Clinic in York.
Yeah.
So we have a website and there is a contact page on that. So,
Brilliant. Okay. Well, thanks so much for coming in to talk to us. I found it amazing. I could probably carry on for another 2 hours and sit here and get a full consultation myself. But I'm going to wait a few years. But thanks so much for coming in, guys. Really appreciate it.
Thank you for asking.
Thank you.